Greetings and welcome to this week's programming of Bring It On. My name is Bob Hayes and I'm going to be your show host for today's show. I'm here with Jim Hickey, who is a candidate for Board of Health in the town of Hanson. The reason for most of these showings that we've been doing and been filming is to host the candidates so the viewership can find out who is running for what office and what their qualifications are and whether, where they live in town and what they do. And I know that Jim, thank you for coming in.
Thanks, Bob.
It's great
Appreciate
to have
you
you. I
having
know
me.
that you're currently a board member on the Board of Selectmen in town.
I am.
And you're running for a position on the Board of Health.
I am.
Can you give us a little insight? Tell us, maybe start out with your family, but give the viewers an idea of what we're dealing with and what you're thinking. And
Sure. I moved to town with my wife, Michelle, and my oldest two children, Megan and Ryan, back in October of 1991. After being here a few years, Erin and Brianne came along. So there were 6 of us in the house. At one point, we had to decide if we were going to move or put an addition on the house. We love being in Hanson, and as pretty much everybody knows by now, we live across the street from Wes and Joanne Bloss. So it's a perfect neighborhood. Perry Ave is a perfect neighborhood. So we decided to put on the addition, and we stayed. All 4 kids went to Whitman-Hanson High School. They all went to different colleges, graduated, and half of them have moved away. I think the last time I was here in 2017, Megan was in New Orleans. She's now married and a mother of my only grandchild.
oh, congratulations! That's
Thank
awesome.
you very much. Isla Claire Schmidt is her name, and Megan and her husband Drew live in New Hampshire. Ryan is now down in D.C. I think he was in Chicago at the time, and he's looking to come back this way. And Erin and Brianna are still at home. So the dynamics of the house have changed a little bit.
So you have a house full of Hansonites, but 2 of them were out on their own.
Yeah.
That's not a bad thing. Didn't the Halls used to live on Perry Ave? I used to know everybody,
Yeah.
that lived on Perry Ave, but it's been a long time since, I was a young man and was running around the town of Hanson, but we knew about everybody that lived there.
Right.
I remember the Halls used to live there.
And
So,
yeah, and it's true, and it's actually hard on my street. It's hard to get into the streets with Linda Vale across the street, Wes and Joanne, the Shepherds down the street. The Webbers moved but sold their house to their son. So our end of the
Nate bought the house?
Andrew did.
Okay.
Yeah.
All right, because I remember Nate was an awesome pitcher.
Yeah.
If I remember correctly.
Different family though.
Yeah, okay.
Yeah, so it's only the house right next to us that have changed hands a couple of times, and the young couple that are there now are great.
As we've said, Whitman and Hanson are great places to live. If I remember correctly, half of Perry Ave's in Whitman,
Yes,
and the other half is in Hanson. So
yes it is.
we've always thought of Whitman and Hanson as one big family, so to speak, connected by a regional school district. So
That's
Jim,
true.
what possesses a guy that's on the Board of Selectmen to run for the Board of Health? I know there are many, many seats for different things to do, and this is probably the biggest year I've seen for candidates, for everything.
Right.
We have 4 for selectmen for a 3-year and 4 for selectmen for a 2-year with the departure of Matt Dyer. But as I understand it, and correct me if I'm wrong, because I have been wrong plenty of times, every person that's on the Board of Health is running also for a seat on the Board of Selectmen. Is that correct?
That's correct.
Okay, so what possesses you to do this?
Well, the first thing I did was I just did a little research, and by little it was just really going to the town clerk. As long as it's not a paid position, you can be on, whether appointed or voted in by the community, as many boards as you want. I know that there are members now that are on the Water Commission and on the Board of Health. And as you said, all 3 are going for one of the 2 open selectmen seats. So it's possible to be on 3.
Okay.
For me, after doing that research, I looked at it 2 ways. Excuse me. When I came here in 17, I was complaining to my wife that I didn't feel like the Board of Selectmen, were doing the right thing, or as I consider myself, just, an everyday guy. So I ran and I won.
That was in 17.
2017.
We're talking about the selectman seat.
Right.
So you're giving me a little bit of history.
Yeah.
Which is good because I can't remember when you got on and when you didn't. I remember.
Well, what I would have told you back then, I think at the time I was a 27-year member of the Teamsters. And there was no union representative on that side of the table. There was no one on that side of the table that could look at it from a union's point of view to any of the problems we had with any of the unions in town. And I found for me it was very easily separated, because on one side of the table I'm, all for union, but when you get on that other side of the table, you have to draw the line and you have to understand there's only so much that can be done. So I feel the same way not so much in the union idea, but all three members of the Board of Health are running for the two selectmen seats that are open.
Yes.
So I've been complaining to Michelle about it, and found
Michelle
out,
meaning your wife, because somebody might.
yeah, my
Okay.
wife Michelle,
Okay.
and I found out, through Beth Sloan, the town clerk, that I could actually hold two positions. So I looked into it more. Michelle and I sat down one night after dinner and actually talked about it, because being a selectman does take up a lot of time. That's obvious. Anybody that's ever done it would tell you that it does take up a lot of time. But I decided that if the three board members from the Board of Health are running for the selectmen, there's either one or two things that's going on. Either the Board of Health is broken and they're trying to get out, or the Board of Selectmen is broken and they want to, I would say move up or have a position where they're more involved with the town instead of just the health issues in town. So, and as you know, Bob, the Board of Selectmen has no jurisdiction over the Board of Health.
Because both positions are elected, correct?
Correct.
I'm just trying to give the viewers sort of a snapshot of elected versus appointed. And an elected official is a person that's running, that the people from the town vote in, versus the selectman maybe appointing someone.
Correct.
And they have complete different jobs to do. And neither one can push one way or the other with each board, correct?
Correct. We can only suggest.
Yes.
So that's when I decided that I would pull papers, and I got plenty of signatures and turned my papers in, that I was going to make a run for the Board of Health, because I think it needs to be fixed, quite frankly. Mm-hmm. You've known me a long, long time.
Oh, Jim, I've known you you can probably tell me better year-wise, because the years, but
It was probably
our
the-
children are the same ages,
Yep.
so, and they were all my kids were
It would have been the first year, Megan's 34, it would have been the first year she was eligible to cheerlead in the second grade.
yeah,
So,
Do the math.
that's going back 27, 28 years.
yes.
I've never sugarcoated anything. And it's my opinion that I think the Board of Health is broken. And I think I can fix it, again, my opinion, but I've dedicated the time to doing the best job I possibly can as a selectman. And I want to use my time to do the best I can for the town with the Board of Health.
Jim, you just made the statement that you think it's broken. Can you elaborate?
Something to back that up?
Well, you sound like a guy that's done some history, and you didn't jump into this without some forethought. I mean, the way you did the selectmen's race in 17, that you're bringing this up, it's bringing it all back to me, kind of.
Right.
And it's good because I need a history lesson myself, because as we all age, some days I'm in one room, I walk into the other room, and I say, what am I doing in here?
Right.
So, it just happens. What do you
okay.
think? Well,
Well, even in marriages, you have lack of communication.
oh, no
Well,
question.
Okay, so you can imagine what it's like at town hall, or different committees and commissions trying to get together to get something done. So I believe it was 2 Tuesdays ago, which would have put it at probably March 22nd, when I heard for the first time that the Board of Health was going to raise the dump sticker fee or transfer sticker fee, whatever you want to call it. And I use the transfer station now myself. But they went from a 3-year sticker at $30.
Let me just interrupt for
Sure.
1 second. This is just a few weeks back, and I hate to date shows, but that's okay. That's fine. You're only talking, though, a few weeks ago.
Right.
That this decision was implemented, like not before COVID.
Oh, no.
Or during COVID or any of
No.
the above.
Right.
Okay.
And I mean, I can go back to even before I became a selectman, listening to the Board of Health in the pay-as-you-throw program. And as a Teamster now for over 30 years, I work for a trash company. Obviously, being a driver, I'm at the lowest level. But when you have pay-as-you-throw, it's different than what people would normally put out. So sitting in the audience after coaching a softball game because I wanted to learn what was going on, and then, this program was supposedly going to pay for itself
The pay-as-you-throw.
in 8 years,
Okay.
and that the transfer station would be self-efficient, and it's far from that. So with the situation with the dump sticker, they implicated it 3 years ago, $30 for a 3-year sticker. Easy math, $10 a year. This year, it's going to be a 2-year sticker for $100. That is a 400% increase, if I did the math right, over what the previous cost was. So, and I'm not privy to what the Board of Health did. I can only tell you what was said to me. So when you come up with that figure, how do you come up with that figure? Is it what they need to keep the transfer station open 5 days a week? So they pass that total cost over to the people of Hanson? So for me, that's one of the things that I think is broken. The transfer station system is broken. We need to know how to fix it. Now, I don't need to be a selectman to tell you we're going to supplement, or they're looking to supplement, the transfer station with $165,000 this year.
And that money would be coming from free cash?
Yep.
I'm just trying to, because a lot of people get confused about
Right.
when you talk supplement, town budgets are a big deal, and it's not as easy. I know you're talking pay-as-you-throw. I personally had hired, because everyone on my street has I guess a private hauler,
Yep.
you would say. And the reasoning that I had is the hours for me weren't working properly. I didn't even know that there was a sticker or a sticker fee, and I paid it. Obviously, I'm just trying to get it. And there's a bag fee too. If I remember correctly, I used to buy bags
You get,
at the hardware store.
Yep.
I think.
yep, they have them down at the
Small
hardware
bags and big bags.
Small bags were 8 for 10, now they're 8 for 11. Big bags were 5 for 10, now they're 5 for 11. So it's been increased over time, and the program itself is not working. So it needs to be fixed. Now, you just mentioned that you had a private carrier come in.
Yes.
And I've talked to a couple of people, and they've gone through different private carriers because either the first one didn't work out or, whatever. But the private carriers are now going up to anywhere from, I know that this person is paying $95 a quarter. So I'll just use this one.
$30 a month.
I'm sorry?
$30 a month.
Yeah, or $380 a year.
Yes.
and I'm not saying this is going to happen, Bob, but if it was possible to get your trash picked up curbside for $340 a year, would you be, willing to do that, where a private carrier is up to $380, $390, $400, where we have one carrier, like Whitman. Whitman uses Waste Management. I'm not saying it would be Waste Management. I'm just saying one carrier. Obviously, it's going to go in your taxes, but I don't want people to think, oh, there he goes, he's talking about increasing taxes. That's not what I'm talking about. I'm talking about you taking the $400 that you paid a private carrier, you're going to have to pay it in your taxes, but now your trash gets picked up. And you don't have to go to the transfer station. You don't have to worry about, 3 different trash trucks going down your street on the same day. It's one carrier, and it would be anywhere from a 5 to a 10-year contract. When they come out with the toters, that's how they work. You buy into a contract for a long time and you get the toters for free. That's just one example. We're through COVID now, but the COVID situation was a whole other thing. There weren't monthly reports coming to the BOS that I saw.
The Board of Selectmen, correct?
Yes.
Okay.
The fire department did a great job. I was with the Board of Health agent and the executive assistant to the Board of Health when we gave out the free COVID shots. The COVID tests to the people. We used the McQuan School, and it was in and out. We had like 10 people. They just pulled up, boom, show your license, and you got the test. They had a booster clinic at the senior center, and they had a ton of people going through there. I attended that also. I think there's some problems up there, and I think I'm the guy to straighten it out.
So that's what's given you some of the reasoning to run.
Yes.
Jim, backing up just a little bit, I know that we're talking about COVID because it's related, and I kind of brought that up and backed the whole thing up. If the town had to supplement the transfer station $165,000, that's over and beyond what the sticker fees were.
Correct.
And what the trash bag fees were, because again, to recap, you have to have a sticker.
Yes.
And you have to, I'm asking,
Yep.
and a trash bag, because I don't do it.
Right. I didn't do it.
Is that a big number when you break it up by the amount of houses? Because I don't know.
Right.
And if I don't know, I ask questions.
Right.
That's
Well,
why I'm asking.
we have 17, last check, 1,734 homes in Hanson. And I would obviously have to do the math.
Yeah,
but
yeah.
When you go from $10 a year transfer station sticker to 50, what gives? So, and I don't have the answer to that, and maybe one of the members of the Board of Health that are running for selectmen maybe could answer that for you. I would rather not, throw something out there because I don't want to start
Sure.
anything. All I can tell
makes
you
sense.
is what was said at an open meeting. But there are problems. And like I said at the beginning of it, there's, problems with husband and wives communicating. There's problems at town hall with one department communicating with another department. For me, this would be an opportunity if people decided to put me in the office of Board of Health. That bridges a big gap because, not only am I on the Board of Selectmen, now I'm on the Board of Health, and there's less of a communication gap, at least between those two that have no jurisdiction over one another. One can't make the other one do anything.
So it'd be almost like a liaison type of affair. Is that what you're saying? Like you could make a report? I'm
Right. Well,
questioning.
I think that I would be able to answer any of the selectmen's questions that don't attend Board of Health meetings that are at 4 in the afternoon, which makes it a little bit harder for most people to get to. which would actually, it's a perfect segue to the the Council on Aging, who have their board meetings at 11 o'clock on Friday mornings.
The Council on Aging
Yeah.
having a board meeting at 11 o'clock probably isn't as bad. How I know that meetings, I've been on a few boards myself, and especially being on a school board, we would have it at night because any parents most of the time would be working. The Council on Aging, I would think, probably has a few people that, if they wanted to attend, may have a problem at. But how does the Board of Health, if they have a meeting at 4 in the afternoon, how do they deal with, is their office open at night? So I'm not privy.
Right.
Thank God I haven't had to go to any of these types of
at
things.
Town Hall, it's open till 8 o'clock like all the other offices. But they found that at 4 o'clock, to meet was the perfect time for everyone. Like we moved the selectmen's meetings from 7 to 6 because it made more sense, at the time. And now we've just kept it like that. The reason I brought up the COA meeting at the first Friday of the month at 11 o'clock is because I attended that meeting this morning. And with the Board of Health, that brings me back to the COA. We have the senior center, and I'm sure, as you know, Bob, because we were so involved with sports back then, and I'll pick softball because that's what I was in charge of. I had 13 teams that played in town between 3rd and 8th grade. 13 teams. We never left Hanson.
Yep.
Now, 12, 15 years later, there are 4 teams, and they're combined with Whitman. So even the Spring League travels. Now, they're doing a great job with the T-ball section. The girls get to start off, playing softball right off the bat.
Sure.
And some of the stuff they've implicated has been great, but those numbers have dropped. Yet in 2010, the town of Hanson had a population of just roughly 10,250 people. 2020, we have 10,750.
So we've added approximately 500 people. So
Correct.
Is this bringing the Board of Health job to a more difficult place? Because I know, and I'm asking.
Right.
I'm making some assumptions because I bought and sold a few homes. The Board of Health is also involved with septic systems.
That would be the health agent himself, yes. And that would be a separate issue.
But I mean, isn't that still under the? I'm just.
Oh,
so
yeah,
People, the whole purview of the Board of Health is like septic systems. Do they get involved with like Shaw's food? Do they?
Yeah.
Is that some of the? What else do they do? In other words, some people think it's just a transfer station.
Right. No,
and
the
maybe
board.
Septic systems that because Hanson doesn't have sewage.
Right.
What other things the Board of Health? Do they get involved with like town animals? Some people in farming. Is that under the purview of the Board of Health?
With the Board of Health itself, you don't have to be certified in anything. As a member, I'm not certified as anything. The health agent has 8 to he actually has 10. He or she would have 10 certifications that they need. But the last 2 are handled by the fire department. They're emergency, what's it called? Like if we had a disaster.
Preparedness?
Yeah, the fire department handles that. And then after the disaster is a separate certification, which the fire department has, and they would handle that. But food inspections, septic inspections, restaurants, there's 8 of them total.
Can we just stop for 1 second?
Sure.
Because I'm trying to learn some more about this too, and I'm sure that some of the viewers. The Board of Health, do they go in and inspect restaurants, is what you're saying?
No, the health agent does, not the Board of Health.
But I mean, it's the Board of Health's responsibility. Like if the health agent, I'm asking, if the health agent went in and said, there's 3 violations, they would report that to the Board of Health, and the Board of Health would send a letter to the restaurant. Is that how
Correct.
that works? I'm just,
Yeah.
so people get a better the importance of the Board of Health. A lot of people don't realize how important certain boards are in town. They say, oh, that's nothing, because they don't know, and
Right.
they start making up their own terms. The Board of Health is a lot more responsibility than people are thinking.
Oh, absolutely.
And COVID has brought that out, I think.
Absolutely.
So go ahead, and I didn't mean to interrupt.
No, that's okay. So there's 8, criterias that you would want your health agent to have. They should be certified in all of them. But in some of the cases, we have to subcontract work out,
Okay.
which ends up costing the town money. But the reason I brought the COA into it in the senior center is because our population has pretty much stayed the same, 500 people. But so the number's pretty close to what it was in 2010. But we closed the elementary school. And softball, the numbers went down. In baseball, they went down.
Everything's done.
Everything's gone down with youth sports. That's why we closed the school.
Yes.
So I don't want to call them seniors, I'll call them retirement age people, has grown, and it's grown a lot. We have 45% of the people that live in Hanson are 50 and older. 33% are 60 and older, and 13% are 70 and older.
Wow.
So almost half of the population is getting ready to retire or retiring.
So we're going to have some turnover.
Yeah.
This is all fabulous statistics, Jim, and you're not going to believe it, but our half hour is coming to a close.
No way.
Oh, definitely. I want to get you back on, and especially should you get elected. So now that we're talking about that, look right into that camera and tell the people why they should elect Jim Hickey to the Hanson Board of Health.
I would have to say that if you like what you heard today, if you know me at all, if you've been to any meetings or talked to me outside any hall, you know I don't sugarcoat things. If I can't fix it, I try to find a way to fix it. And if I said it in 2017, if you like the way things are, stick with what you have. You want to try something new, try me on the Board of Health. Thanks.
Ladies and gentlemen, thank you for watching this programming of Bring It On. If you like what you heard today, or you have anything that you would like to see on Bring It On, you can contact me, Bob Hayes, at 617-538-0189, or my email address is bobhayes4433@gmail.com. Thank you for watching this episode of Bring It On.